Thank you, everyone, for inviting us to share a little bit with you today about Pennsylvania's new insurance exchange, new health insurance exchange, Pennie. We are currently in our second annual open enrollment period, and we are helping a lot of people here in the Commonwealth of Pennsylvania get protected. Joining us today to help us get things kicked off is Pennie's Executive Director, Zachary Sherman. And with that, I'd like to turn things over to Director Sherman.
Great. Thanks, Scott. Good afternoon, everyone. Thanks so much for the opportunity for Scott and I to be here to talk to you a little bit about who we are, what the marketplace is, and how people can get covered through it. So I'll Scott and I are going to do this together. I'll start with kind of the background and origin and the who we are, and then Scott's going to get into the details around, how what we offer applies to people through specific scenarios, and then how folks can navigate the process to get covered. So starting at the top, Pennie came out of a bipartisan initiative that passed both chambers of the General Assembly in early 2019 and was signed into law by the governor in July of that year. This legislation passed both chambers unanimously and was very resoundingly, universally supported as something positive and adding a lot of value for the Commonwealth and its citizens. What it created was two programs effectively for the price of one. One of them being the eventual transition from the federal marketplace, healthcare.gov, to a state-based marketplace, which became Pennie. Through that transition, there was an expectation that we would add more value while also saving money, something I'm proud to say we've been able to do, and was very key and critical to the legislation working, because those savings could be used to invest into a affordability program to reduce the cost of health insurance in the individual market where we operate, reducing the cost of health insurance from what it would have been had we just stayed with the federal exchange. So we got a new state-based entity created for the purposes of expanding access to coverage for those who don't have it, and we got a reduction in the cost of health insurance from what it would have been had we just stayed the course. And the kicker is it cost us no more money. For the money that we were spending just on healthcare.gov, we were able to redirect that to fund both these programs, and it did not cost us any additional resources. So fast forward to last fall, we launched formally and officially on November 1 of last year as Pennie, as the new state-based health insurance marketplace, with a goal of improving the accessibility and affordability of individual market health coverage for Pennsylvanians. We do this by being the official health insurance marketplace for the Commonwealth. We have replaced healthcare.gov. If a Pennsylvanian goes to healthcare.gov today, as soon as you type in your zip code or tell them where you live, they will redirect you back to our website or to our call center. We are the home for high quality, affordable health insurance plans, and very importantly, the only source for financial assistance to reduce the cost of coverage and care. We provide premium subsidies, we provide cost sharing subsidies. Premium subsidies reduce the monthly cost of health insurance. The cost sharing subsidies, for those who are eligible for it, can use it to reduce the cost of their out-of-pocket expenses, including deductibles. We exist to serve and provide coverage for individuals and families who don't have health coverage through some other means. So individuals and families who are uninsured, individuals and families who don't have access to job-based coverage, sole proprietors, part-time workers, gig economy workers. We really are that place, that niche where if you don't have job-based coverage, if you're not old enough for Medicare, if your income's too high to make you eligible for medical assistance, that's where we come in, and we provide quality comprehensive coverage. We provide assistance along the way, at no cost, and we provide financial assistance to make it affordable. That financial assistance is available to more than 9 out of 10 of our current customers. I mentioned we provide assistance. We provide enrollment and customer service in a number of channels. We know that the process of enrolling in, applying for, picking coverage, picking a plan is overwhelming, can be confusing, can be complicated. That's where we come in. We're unbiased. We're not an insurer. We are a marketplace where you can go, and there's a number of tools and services that we provide. So we have online self-service tools. We have a dedicated call center. We have partnerships with community-based organizations, nonprofits, licensed insurance brokers. Assisters and brokers provide enrollment assistance. You can get connected to them through us. We can set you up with appointments. And they have all, they exist to provide you with the one-on-one enrollment assistance that you might want to get through the process. And you can get connected to them through us. So as I mentioned, we are, eager to reach and educate the uninsured about their options, about the financial assistance that we provide, and so we spend a lot of time thinking about how to do that, working, strategizing, executing on ways to reach the uninsured, and data is super useful in that. This map, this map provides you with a county-based overview of the uninsured across the Commonwealth. The darker the blue the county, the more the uninsured live in it. And just calling out Center County for a second, there's over 13,000 uninsured in Center County, and while that's not the highest number on the map, that's still a lot of folks, and we know a lot of folks there are eligible for what we provide, are eligible for the financial assistance that we provide that is really significant. 9 out of 10 of our customers receive it, and for a lot of them, it's really the difference between their ability to pay for their health coverage, access healthcare services, and going without. So the last thing I want to touch on before I hand it over to my colleague Scott is that we've seen some recent changes. We're new, and even in the 1 year of being alive and well, things have changed pretty dramatically for us. And one of the biggest things there is the American Rescue Plan, which was passed by Congress and signed into law by the president in March of this year, and in a lot of ways was a comprehensive response to COVID-19 and the impacts, the public health and economic impacts of the pandemic. One of the things that the American Rescue Plan did was increase the amount of financial assistance, the premium savings that we provide kind of across the board. It increased the tax credits that we provide at every level of income. It made them available for groups that were previously ineligible. So prior to this, if your income was above $51,000 for an individual or $105,000 for a family of 4, you were out of luck in terms of getting financial assistance. You could still enroll in a plan. You would just have to pay full price. In some cases, that was way too expensive, and people were going without. That's changed. That's changed at least for this year and next. And now the amount that those individuals, those families pay is capped at 8.5% of their household income, meaning in a year, meaning if the premium is above that, we provide financial assistance to help cover it. And in some cases, it's resulted in thousands and thousands of dollars of savings. And with that, Scott's going to show you. Scott's going to give you a couple different scenarios, kind of showing you how these increased savings have really made a difference.
Absolutely. And thank you so much, Director Sherman. And thank you again, everyone, for taking time out of your day to learn a little bit more about Pennie and the work that we're doing right now here in the Commonwealth. As Director Sherman showed us on the heat map, we have about 607,000 uninsured individuals. That's 1 in 20 of our friends and neighbors that wake up every day go out into the world without the protection that is afforded by health insurance. Um, it takes a very, very short Google search to determine what the number one cause for bankruptcy is. That number one cause is typically medical bills that are unmanageable. So we're here to spread a lot of good news in terms of being able to connect with individuals, who are uninsured or looking for options. Um, and the scenarios that I'm about to share with you sort of fill in the gaps on three different scenarios. The first of which is this gentleman. Um, he makes about $19,000 a year. Um, Prior to the American Rescue Plan, this individual would have paid about $66 a month for Pennie's benchmark plan. And now at Pennie, we have three different metal tiers. We have gold, we have silver, and we have bronze. All of our health insurance uh, plans, they are required to meet the 10 minimum essential health benefits that are set forth by the Affordable Care Act. You cannot be denied coverage because of a pre-existing condition. And that's important, especially for individuals who might be in workforce transition. Um, and if you're under the age of 26, you can still remain on your parents' plan through Pennie up until the age of 26. So um, this individual, again, we're looking at our benchmark plan, which is our second lowest cost silver plan in any given market across Pennsylvania. That's really good insurance. And we'll get into that a little bit more here in a second, but the fact that it would have cost this individual $66 a month when he's making $19,000 a year, that's significant. Under the American Rescue Plan, we are now able to offer this individual that same level of protection for $0 a month. That saves him $792 a year. Now, again, depending upon your perspective, $792 might not seem like a lot, but if you make $19,000 a year, that's a lot of money. And speaking of a lot of money, we all have friends, neighbors, family members who have done everything right. They work hard, they save their money, they set aside the funds necessary, and before you know it, they're retiring early. One of the things that can tremendously tax individuals who retire before the age of 65 is the cost of health insurance. Okay, so in this scenario, you have a couple. They're 64 years old. They retired 1 year early. Together, they make $77,580 a year. Now, again, prior to the American Rescue Plan, this couple would have paid $2,462 a month for their health insurance. That's astounding. But remember what Director Sherman mentioned happened under the American Rescue Plan. Now we're able to cap their level of financial assistance based upon that income, 8.5% of that income to be exact. And what we're able to do is reduce their premium from $2,462 to $550 a month. That saves this couple nearly $23,000 a year. And for a couple who's heading into what should be a very carefree time of their life, saving 23,000, it can be absolutely life altering. Here's a more common scenario. And this scenario is a family of four. Okay. This family of four makes 52,000 a year. Prior to the American Rescue Plan, this family would have paid $285 a month to cover four people, which when you think about it, that's really not that bad. But now, under the American Rescue Plan, $87 a month. That's just a little over $20 per person to cover a family of four. And that saves this family $2,300 a year. So with that in mind, You heard Director Sherman mention early on that because we brought the health insurance exchange home to Pennsylvania, number one, we created a competitive marketplace. Number two, we were able to hold that financial assistance in place to provide access to quality health insurance for all Pennsylvanians. On the backside, we're we're because we have local control, we were able, February 15th of 2021 to August 15th of 2021, we were able to create a COVID-19 enrollment period. And guess what? We were able to insure 65,000 more people under that COVID-19 enrollment period. And coming out of that, we realized that nearly 50% of our customers were paying less than $1 a month for their health insurance. That 68% were paying less than $50 a month. That's the impact of the American Rescue Plan. And it is in force for 2021 and 2022. And the good news is legislators and policymakers are already trying to address the what if question of what happens in 2023. So knowing that we have local control here in Pennsylvania, it's meaningful. It means that there are a lot of people that we can help. And speaking of a lot of people we can help, right now we are in the midst of our open enrollment period. The looming deadline right now to cover Pennsylvanians is December 15th, if they wish to have coverage in place by January 1 of 2022. We are doing our very best to get the word out across the Commonwealth. In fact, many of you will probably see our commercials on TV, radio, online, on buses, on billboards, etc. throughout the state. But December 15th means a lot to us. We want to make sure as many of our friends and neighbors are protected by January 1 as we can possibly get. December 16th to January 15th is sort of a buffer period because we realize not everybody is going to make the initial deadline for January 1 coverage. So here in Pennsylvania, we provided an extension, and our open enrollment period deadline is actually January 15th for coverage on February 1 of 2022. Okay, now a lot of people, they think, okay, well, after open enrollment, Pennie goes away. No, we don't. Like Director Sherman said, we're not an insurance company. We are the marketplace. We are the insurance exchange for Pennsylvania. The insurance carriers in Pennsylvania come to us to sell their best products. We're here to help. We're here to help educate. We're here to help provide financial assistance. And at the end of the day, we want to provide very competitive insurance options for people. Now, that brings me to a very important thing, and that is January 16th through December 31st of 2022, Pennie has special enrollment periods. And those special enrollment periods are actually triggered by very, very important life events. And a couple of them that I can mention right off the top of my head, getting married, getting divorced, having a death in the family, having a birth in the family, moving from one zip code in Pennsylvania to another that might actually change your insurance market, losing your employer-sponsored coverage. That's incredibly important because a lot of our, like I said, a lot of our neighbors right now are between jobs and they get that COBRA letter in the mail. And as you know, as soon as they're waved off of the floor with smelling salts, they start looking for options. And Pennie is a very, very good source for those options. So in addition, we are here to, provide, help to individuals through qualifying life events like being released from incarceration or gaining lawfully present status here in the U.S. There's a lot of help for individuals throughout the year. So please keep in mind that's our purpose. That's why we're here. And speaking of help, before Director Sherman and I open things up for questions, we do want to point out that our call center is and works for the residents of Pennsylvania. They are unbiased, no hassle professionals that can educate someone in English, Spanish, or we have a language line with over 240 translators ready to help people in their primary language to get to a point where they understand the financial assistance that's available to them, that they can shop and compare plans, both health and dental, okay? And they can be in a position where that customer service representative can actually help them acquire that health or dental insurance. So in a very, very short time, a customer can go from being uninsured to having protection for their quality of life. As Zach also mentioned, throughout the Commonwealth of Pennsylvania, we have thousands of Pennie certified insurance brokers in communities throughout Pennsylvania. And they can be searched for right through pennie.com, our website. Okay. And they are the only licensed professionals in Pennsylvania who can actually make a professional recommendation on your behalf. But in communities, we also have individuals that work for hospitals, health centers, faith-based organizations, community groups, and those are our assisters. Our Pennsylvania Assister Network is phenomenal. They, again, much like our customer service representatives, they provide unbiased assistance and guidance in local communities. And again, they're in a position where they can meet virtually, they can meet in person. They are a tremendous resource. I want to point out that during open enrollment, okay, our call center is open Monday through Friday, 8 a.m. to 7 p.m., and on Saturdays, 8 a.m. to 1 p.m. Okay. With that being said, again, Zach and I appreciate your time, and everybody here at Pennie appreciates your time. We did record this session, so it will be made available as a community resource for you.